We're now questioning the benefits of breastfeeding and a new painkiller that has some medical experts worried.
Let's talk about it. Dr. Adam Ofer offers us some insight, and he's joining us on the couch. Good morning, doctor.
Good morning, guys.
Welcome.
Happy to be here.
Thank you for joining us. Now, there's a study out that questions the benefits of breastfeeding, and that's sure to prompt some heated debate.
Yeah, I need to sort of tread lightly here. I don't want anybody thinking we're saying breastfeeding is not good. There are some seriously proven benefits to breastfeeding, including oxytocin release for the mom, which helps with bonding. It helps get rid of some of the bleeding after delivery, decreased risk for breast cancer, decreased risk for ovarian cancer. For the baby, for sure, improved immune function, decreased lung infections, decreased gut problems. So let's be clear, we know for sure breastfeeding is the best if you can do it. However, there are some long-term things that have been touted forever, like kids who've been breastfed are smarter, better IQs, less chance many years down the road for some cancers. That may turn out not to be true.
Oh, so is that what the study is saying?
Yes, this looks at some of the more long-term stuff. And they did it in a kind of a cool way. They took families where one kid was breastfed, one kid was not, but since it's one family, it's the same socioeconomic status, same working mother, same not working mother. And probably the studies in the past that looked at kids and said they might be smarter if they were breastfed actually was confounded, because you looked at families, if they were not breastfed, maybe some of those families had lower socioeconomic status.
Right. So you remove more of the variables.
We remove the variables, and it may turn out that some of the long-term things maybe are not as beneficial as we thought. But short-term, if a mom can breastfeed, it's definitely best. The one reason I'm happy a little bit about this study is because I see so often, I'm an obstetrician, so I see so often I round on women a day or two after they've delivered. They're hysterical crying sometimes because they're having trouble with breastfeeding.
There's a lot of pressure.
The pressure's unbelievable.
It is.
And the way, women, for 9 months you're pregnant, you're going through physical changes, hormonal changes. Not everyone can breastfeed.
Absolutely.
So it's best to try, but it shouldn't be this crazy stress, guilt thing if you can't.
Yeah, all right.
I want to talk about this breakthrough in the fight against Alzheimer's. It's a test, correct?
It's a blood test. It's not out yet. This is research, but this is very, very hopeful. And, to understand why it's so important, you need to understand what Alzheimer's is. 35 million people worldwide suffering from Alzheimer's. It's going up as the population ages, especially in America. But when you see somebody who's forgetful, it didn't start then. It starts decades earlier as proteins build up in the brain. Proteins called amyloid and tau proteins build up in the brain. It happens decades before you see signs. This is the first test that might help us detect those changes many years before you see symptoms.
But then is that going to help us slow the disease down?
So not today, but as research advances, it looks like once those proteins have built up, once there are changes that are permanent in the brain, we may not be able to reverse that. If I can figure out today that I'm going to have those changes 10, 20 years down the road, I may be able to impact that today.
Yeah.
Okay, so now also we wanted to talk to you about a new painkiller that has a lot of people worried. Tell us about this.
Very, very worrisome. So there's a new painkiller coming out on the market that is 5 to 10 times stronger than any narcotic that is out today. Okay?
Why would this be even on the market? Who would actually receive this type of pill?
So there's a small population of patients who suffer long-term chronic pain conditions, people who really are crippled with pain, cancer patients, chronic spine injury patients, who really are suffering, and they need this. The problem is this: about 20,000 people die each year in this country from drug overdoses and narcotic dependency problems, and this is a drug that can be abused. Hydrocodone, the active ingredient in this drug currently, is combined with acetaminophen, Tylenol. So that kind of limits the ability to abuse it, because your liver is going to give way if you try to take too much of it. This drug is pure hydrocodone. It can be taken by itself, and it's so strong that if a child takes even one tablet, they may overdose on one tablet. So this is very, very worrisome.
Right.
Well, who's going to prescribe this then? I mean, I'm hearing that doctors are afraid of this.
I'm afraid of it. So it's going to be a Class 2 medication, which means that it's going to have some greater oversight. You're not going to be able to have refills on it. People have to come to the doctor often. The problem is, once a drug like this is marketed, sometimes the marketing ends up widening. So right now we say it's a narrow group of patients, but it ends up being widened. You end up getting some of these drugs on the street. They can be crushed easily, these tablets. They can be snorted. And this is sort of, some people are calling this sort of a drug dealer's paradise, and it's going to be a real problem.
Well, we hope not. Yeah.
Well, Dr. Adam Ofer, this guy's good. Plus, good-looking guy, too.
No kidding. Yeah, but he's taking ladies.
Sailed right through med school. Thank you so much for your insight. We appreciate it.
Thank you guys so much.